Hi, I'm Dr. Tom Casale, Professor of Medicine and Pediatrics at University of South Florida in Tampa. And I'd like to discuss some therapies for the treatment of severe asthma. These therapies are called IL5 blockers. Interleukin 5, or IL5, is a molecule produced in many cases in patients with severe asthma. And what it does is it causes inflammatory cells, called eosinophils, to get into the airways. These inflammatory cells then cause havoc in the airways. They release chemicals and mediators that can promote airway hyperresponsiveness. They could cause more inflammation, mucus production, etc. So there are a lot of things that are important in asthma that could conceivably be blocked if you were able to negate the effects of IL-5, that is, the molecule that causes eosinophils to come into the airways. We currently have 3 treatments that do that. 2 are what are called monoclonal antibodies to IL-5. They bind IL-5 and take it out of the circulation, so it's not effective. The other one, benralizumab, actually binds to the receptor for interleukin 5 so that IL-5 can bind to a cell and cause those eosinophils to migrate. All 3 of these, mepolizumab and reslizumab, the 2 IL-5 monoclonal antibodies, and benralizumab, are able to prevent approximately 50% of exacerbations in people that have severe asthma with eosinophils that are elevated in their blood. They also improve symptoms, quality of life, and in some cases, improve the ability to breathe easier. And that's manifested by symptoms as well as improvements in lung function. There are differences between the 3. Reslizumab is only approved for patients 18 and above, and it has to be given intravenously. Mepolizumab is injected, and that injection can be done at home by yourself. It's a subcutaneous injection, and it's typically every 4 weeks. Benralizumab is also a subcutaneous injection, and this one, you get the first 3 injections every 4 weeks, and then afterwards, every 8 weeks. All 3 have been shown to be effective. Very difficult to show differences between the 3. They're all effective. So ask your doctor if you're an appropriate candidate for one of these IL-5 blockers. If you have severe asthma, you're symptomatic, your lung functions are compromised, you have elevated eosinophils in your blood, and you have a history of asthma exacerbations. Thank you, and I hope this was helpful.